Hello, and welcome to our presentation on externalizing behaviors in youth and why parenting interventions during early childhood are effective and necessary. So, externalizing behaviors are specifically referred to as disruptive behavior and are the most common behavior patterns of children with emotional and behavioral disorders. Characteristics such as aggression, antisocial actions, and delinquency are common in youth with externalizing behaviors. 20% of children from low-income families display these kinds of behaviors. Children with externalizing behaviors will typically disobey rules, exert physical aggression, and sometimes seem threatening to others. Instead of expressing their negative emotions, such that we all have and experience, children with externalizing behaviors direct their feelings toward other people and other things. All children experience times where they are aggressive, where they act out, hit, throw fits, but children with externalizing behavior difficulties do so more frequently and use higher levels of aggression when doing so. Externalizing behaviors have various factors which contribute to their formation. There are both biological and social influences on their development. For example, nutrition, maternal drug use, and genetics are all physical factors which play a role. Poverty is also a physical contributing factor, with nearly 20% of children from low-income families displaying difficult and challenging antisocial behaviors. Being raised in poverty places children at a higher risk for a wide range of problems. Research shows that poor children are exposed to factors that increase their risk for developing externalizing behaviors and also affect their cognitive, social, and emotional development. Emotional and psychological factors that result from this poverty include poor parenting practices, which are directly tied to poverty. Parents who are living in poverty typically show inadequate parental involvement and poor parenting practices, and these parenting practices have a direct impact on a child's behavioral outcomes. Now, we all know most 2-year-olds display some sort of aggression, but without proper behavioral patterns, without proper education, these behavioral patterns become established and ingrained in the child's personality. 10% of mothers of preschoolers report that their child exhibits moderate to severe externalizing behaviors, which is to be expected. These children are young and have yet to know how to control their emotions and their impulses. However, it's what parents do with these behaviors that determines whether or not they become adaptive or maladaptive. And poor parenting practices lead to a downward spiral. Research shows that parents who display hostility or rejection in reaction to their children's inappropriate behavior actually exacerbate that inappropriate behavior. When studying parenting and the effects of parent education on externalizing behaviors, higher parenting confidence and self-efficacy was found to be related to fewer externalizing behaviors, and conversely, lower parenting efficacy resulted in higher reported externalizing behaviors. Now, because nobody teaches a class on how to be a parent 101, parents are often left with nothing other than the parenting which they received as a child to guide their actions. Now, whether or not that parenting was good or bad, most parents will parent like their parents parented them. How many parents can we put in one sentence? So as you can see, there's a downward spiral. The child acts out in an age-appropriate way, typically, but the parent then feels incompetent because they don't understand the child's actions or they don't know how to correct the behavior. The child is then possibly kicked out of their daycare or preschool, which increases the stress level of parents. Again, the parents don't have a skilled knowledge of what to do, and so their discipline becomes harsher, more of the same, more yelling, more spanking, more punishments, which leads to a deterioration in the parent-child relationship, which then leads to the child's behavior escalating. So the more the child acts out, the less competent and confident the parent feels. However, if the parent is given the chance to learn new skills, they can typically respond to that same age-appropriate misbehavior in positive and productive ways, which can reduce the intensity and frequency of the child's misbehavior and lead to higher levels of self-efficacy among the parents. Now, if these behaviors are not addressed, there are large consequences. Externalizing behaviors in youth, so those characteristics we talked about, hyperactivity, aggression, antisocial actions, defiance, and delinquency, cost society between $335 and $350 billion each year. The root of these behavioral problems is linked to those behavioral patterns that are established in early childhood. Interventions during early childhood, so we mean before the ages of 0 to 5, are most effective in changing the trajectory of a young child's behavior, which then changes the trajectory of an adolescent and an adult's behaviors. Approximately 50% of young children who display externalizing behaviors will continue to act out as teens and as adults. Intervention focused on parenting during those early childhood years is the most effective approach. A child's brain is far more malleable, it is more flexible, more accepting of change than an adolescent's, and certainly more than an adult's. This makes interventions easier in terms of how much they cost, how much time they require, and how much effort must be expended by all parties. If these problems are not addressed, the cycle of externalizing behaviors and antisocial actions continues from one generation to the other. So let's discuss the currenting approach to managing these externalizing behaviors. The current approach is to treat and correct these behaviors once they have already reached an unbearable level, as you can see illustrated in those two graphics. Parent or school staff identify the externalizing behaviors that they are an issue to the child and to anyone in contact with that child. Typically, parents are then referred to some sort of specialist to receive an intervention for them and their child. One of the struggles that is part of this whole process of dealing with externalizing behaviors is that parents have agency. And that is a wonderful thing, but it can also be tricky in that there is stigmatization attached to receiving parenting education and taking your child to counseling. And parents don't always accept the intervention. They don't have to. They have agency, and it can be a little bit embarrassing to accept intervention. So sometimes they're referred and no intervention is accepted. However, sometimes parents do accept the intervention, and one of the common forms is parent-child therapy. Families typically seek treatment through counseling or parent education programs. For example, Parent University, which is offered in Maricopa County. The therapists through Parent University create a program designed to improve the child's behavior by instructing both the child and their parents on more effective methods of coping and stress management, as well as expressing emotions in a healthy manner. Another option is parent education. Parent education is also offered through Parent University, which is based out of the Mesa School District, but it is not mandated, and it is a reactive rather than proactive approach to reducing externalizing behaviors. What we propose to you today is the partnership of the Women, Infant, Children program, or WIC, and Triple P to provide positive parenting classes to these parents of low income families before the externalizing behaviors exhibit themselves. Educating parents on positive parenting techniques supports the development of cognitive and social skills in their children. It also supports positive parent-child and child-peer relationships, and it will lead to the prevention of delinquency, risky behaviors, and school failure. Triple P uses a variety of methods to enhance parenting skills and self-efficacy. One of the primary things they do is work with parents in groups, which helps parents to feel supported by others who are experiencing similar issues such as poverty or child misbehavior. The Triple P program is one of the most effective and evidence-based programs with positive parenting practice education. We propose adding semi-annual education courses on parenting skills, family life, and child development to the WIC participants as an efficient way to get much needed information to the most at-risk families. Now, in creating this proposal, we researched mandated divorce parenting program by the Arizona Family Court, and it was shown to have highly successful rates of improving outcomes for both parents and children of families who were experiencing the stressor of divorce. Now, divorce and poverty are closely related in that they're both family stressors. They create high intensity levels of stress and struggle within the family, and they both produce difficult emotions that are hard for all members of the family to work through. We found that there was a logical conclusion. If mandated divorce parenting education could improve outcomes for those families, mandated education for parents in poverty could also improve the outcomes for the entire family. So what is the Women, Infant, Children program? What does it provide? Who qualifies for WIC, and how do people access those resources? WIC stands for the Women, Infant, Children program. WIC is a nutrition program that helps families with children between the ages of 0 and 5, and it helps them find and provide healthy foods and nutritional information to the family. Families qualify for this program depending on their family size and their monthly income. WIC is not only for low-income families, it also can be accessed by low to middle-class families as well. Some of the through the WIC station in Maricopa County include breastfeeding education, farmers market vouchers, family nutrition education. Families are encouraged to participate in as many of these programs as they wish or as few. It is completely up to the families and their unique needs. One program that is not offered by WIC in Arizona is parent education. Triple P, which is the positive parenting program, would be beneficial in addition to the services that WIC already offers, but it could also increase the efficacy of parents in reducing these externalizing behaviors in their young children. So what is Triple P? Triple P focuses on 3 different levels: education, support, and intervention. The Triple P stands for Positive Parenting Program. It is an evidence-based approach that has been in use for over 30 years. Its goal is to create or improve positive parenting practices, which will then improve the emotional and social health of children. The services are designed to meet the needs of any family with children between the ages of 0 and 16 years old. Now, levels of intervention. The first level is immediate outreach. Now, this is specifically designed to reduce the stigmatization that goes along with parenting classes, parenting education, and family counseling. This outlet leads to referrals within and throughout the community and encourages parents to seek help without fear of shame or embarrassment. Let's face it, being a parent is hard. And no one really tells you that until you are a parent with the tantruming 2-year-old in the middle of the grocery store. It is okay to ask for help. and that is the primary goal of level 1 intervention, the media outreach. Now, level 2 is a group class approach with seminars taught on topics such as raising resilient teens or the principles of positive discipline. Each seminar consists of 3 2-hour meetings on the particular topic. Participants can interact with each other and with a well-trained instructor, and they can discuss their specific problems, their specific challenges, as well as go through the assigned curriculum. These kind of seminars are primarily what we are advocating WIC add to their benefit requirements. However, there are 3 more levels as well. Level 3 involves instructing parents in clear ways of dealing with specific problem areas for their children. Parents are left with specific tip sheets, which include information about their child's developmental level and what parenting practices are appropriate depending on that level and certain problems that are being experienced. There are also discussion groups that parents can join where they can practice implementing these new disciplining or communication techniques and have time connecting with other parents for that social support. Level 4 naturally goes one step further and teaches parents the skills needed for actually building a better relationship with their child and encouraging positive behavior rather than just correcting misbehavior. The format of these sessions is typically 8 to 10 sessions in either an individualized or group therapy format. The final level is level 5, and it tackles the more challenging family issues such as divorce, addiction, obesity, stress and coping, and anger management. Now, all of these factors are hard issues for families to deal with, and they directly impact a family's ability to function. Triple P practitioners are trained to help in these more serious situations while still enhancing the self-efficacy and the confidence of parents to realize that they can change their lives and they can change the trajectory of their family as well. So it provides structured, formal education with a high emphasis on self-efficacy training. See this as a winning combination, 2 unique programs who are already functioning well in the community, partnering together to provide unique services to a unique audience of families. Triple P already partners with practitioners in the community and community programs that are already in effect. WIC already has an established base of providing resources for families in Maricopa County. By combining these 2, we can bring tested, evidence-based principles which have improved family relationships for decades to at-risk families already receiving services. By partnering these 2 successful organizations, we can keep costs at a minimum by reducing our need for advertising or seeking out those families. And we can provide those most effective and targeted solutions to these families and hopefully stop problems before they start. Combination are many for families. Better communication, better relationships, less tension in homes, fewer behavior problems, less parental depression. Triple P participants have been shown to feel empowered to take control of their family life and relationships. As parents learn skills like emotional self-regulation, perspective taking, verbalizing emotions, self-care, positive feedback, and emotion coaching while receiving support for the difficulty of their situation, tend to experience less stress, less tension, less depression, and fewer behavioral programs. With more capable parents in the home, children are then able to experience more stable, loving, warm, and nurturing environments, which leads to the reduction of already existing externalizing behaviors or the prevention of these behaviors before they even start. And what benefits families also benefits communities. There will be fewer cases of child abuse or maltreatment, fewer foster care placements, fewer emergency room visits, less psychiatric treatment, fewer school disruptions, and the child and adolescent law enforcement issues will diminish as the home environment and parenting ability increases. Mesa Public Schools are already working with Parent University to provide parenting education after the behaviors have started. We suggest introducing Triple P before problems have started by partnering with WIC and requiring it of participants that they take 2 classes each year, either focused on family relationships, parenting efficacy, or child development. We believe that this partnership will reduce externalized behaviors in some of the most vulnerable children before they reach school age and before they have created disruptions in society. We need to invest in our parents if we are going to invest in our children, and we must invest in our children if we are to be able to improve our society as a whole. Thank you.